Hi everyone, my name is Margot Francini, and I'll be presenting the final briefing on behalf of the workshop group advised by Dr. Stephen Cohen regarding the replacement of lead water service lines in New York City. This is my team. We've been working together since May, and we're excited to deliver our findings. So first, I'm going to talk about a critical environmental health issue in New York City, then outline a bill seeking to amend this issue. Then I'll go into the focus of year one of the bill's implementation, including the program structure and how we're going to measure success. And lastly, what we hope to see from this first year. So New York City is full of busy people with busy jobs that might drop their kids off at a daycare center. Now, they'll likely look into reviews of the facility, maybe get recommendations from family or friends. They'll care about the quality of their playtime maybe, or the quality of their snacks. But what they likely don't look into is the quality of their water. And because this hypothetical daycare facility is in New York City, there is a risk that this water could be contaminated by lead. Now, why is this a particular issue for children, and why is it a particular issue for New York City? Well, lead is a toxic metal that can impact multiple organs and systems, and this can delay the development of children, as well as they can carry these impacts later on into their adult lives. Because of the health effects on children and all age groups, the US EPA has declared that there is no safe level for lead exposure. In New York City, water is notably clean when it comes into the system, but it can be contaminated by lead. And this is because in New York City, some service lines are made of lead. Now, a service line is that pipe that connects the city water main, so all the pipes distributing the water throughout the city, to the specific plumbing that's for buildings or properties. So essentially, there is one service line for every building or property. Now, in New York City, around 150,000 lead service lines remain, and this is largely because up until the 60s, lead was a popular material for pipes because it is malleable and it's also cheaper than alternatives. But because of this, we have legacy infrastructure that is exposing 2 million people across all boroughs. And just based on population statistics, this includes approximately 400,000 children. So New York City Council Introduction 942 seeks to replace all lead service lines in the city within 10 years. And this is responding directly to a federal mandate in 2024 that is requiring the replacement of these lines nationwide by 2037. Under this bill, there are two key parties that have responsibilities, the first of which is private property owners, who are required to conduct those replacements at their properties and are therefore responsible for the $10,000 to $15,000 it takes to do that. Then we have New York City Department of Environmental Protection, or the DEP, and they're required to test lines for lead upon request by the property owners. They're also required to replace lines for free at childcare facilities, and that'll become important later on in my presentation. And they're also required to administer public education programs to inform on the issue as well as efforts towards its remediation. So when this bill was proposed, there's general consensus that we need to get rid of these pipes because they pose a critical public health threat. However, there is disagreement on who should pay for these replacements. Is it private property owners? Is it the city or another authority? And so considering this discussion, as well as the established understanding that lead disproportionately and severely impacts children, how do we propose to strategically address the problem in the first year of the bill's implementation? Well, first, we need to establish the organizational infrastructure, so the personnel and resources within the DEP to carry out the activities of the first year and beyond. Then we're going to build citywide awareness with targeted outreach to households that are able to self-fund replacement. And lastly, we're going to prioritize replacements at 600 childcare facilities in areas with high densities of lead service lines. And so we already kind of got ahead on that, identifying where the childcare centers are. We've identified with geospatial analysis that there are 808 childcare centers with confirmed lead lines, which means approximately 12,600 children are exposed at these centers where they're spending a majority of their waking and therefore drinking hours. And as you can see here, they're majorly clustered in the Bronx and then also Queens and Brooklyn. And so in order to carry out these targeted replacements to cover a majority of these lines, as well as carry out an aggressive public education campaign. We're going to set up 3 teams under existing leadership at the DEP, so under the Deputy Commissioner of Water and Sewer Operations. The first team is communications, who will be in charge of doing more passive advertising on subways, radio, social media, etc., as well as community liaisons and educators who will be conducting in-person education sessions in all 5 boroughs. Then the data team will be collecting and analyzing data in order to support targeted operations, as well as display that data on a website so the public can track the progress and performance of the program. And lastly, we have operations, which will primarily consist of those contracted replacement crews doing the targeted replacements at childcare facilities. So we anticipate the organizational setup, or primarily the hiring, to occur from January to July, where we'll front load the internal and contracted hires that will be critical in the planning stage, which will primarily consist of securing permits and then also designing educational materials to then be prepared for implementation of both the public education campaign and the targeted replacements starting in April. And we anticipate the total budget for this first year to be around $8.6 million. So in order to track progress and also be able to learn from the first year, we want to track performance across 4 key stages of implementation: inputs, work process, the direct outputs from the first year, and then the impacts or effects that will occur later on as a result of the first year's activities. So input measures would include budget allocation and spending, staff positions filled, and the number of childcare sites identified and confirmed to have lead service lines. Then for work process, we're looking at the duration of service line replacement process. We're also looking at if errors occur during construction and the frequency of those errors over time. And then lastly, we're looking at the surface restoration, which would be the patching up of the street following replacement and the efficiency of that process. For outputs, we're tracking the number of lines replaced by the DEP, the number of education sessions held, and the number of advertisements made across the diverse media. Then for impacts, we ultimately want to see that drinking water and blood lead levels go down over time as a result of the replacements. We also want to be quantifying the number of people removed from harm's way. And then lastly, we also want to track the number of privately replaced lines that would ostensibly occur as a result of our public education campaign. So ultimately, by doing these 600 replacements, which the DEP has already done a pilot study where they've replaced 600 lines in 1 year in 2022, we'll be eliminating this exposure route for an estimated 9,400 children. We'll also be establishing critical new information systems to collect and display data to guide targeted replacements, outreach, and collaboration with key stakeholders down the line. For instance, the Mailman School of Public Health at Columbia to do some sort of exposure study. Then lastly, critically, the public is educated so that those with means can act, and also there's general awareness about the issue and efforts towards its remediation. So ultimately, the goal of this first year and the overarching goal of the bill is to ensure that vulnerable populations, in this case, children under 6, are drinking the same clean water that is coming from the pristine reservoirs in the Catskills and elsewhere and distributed throughout the city, rather than water that is jeopardized by these lead service lines just before it reaches the tap. Thank you.
Thank you. Great presentation. You mentioned that public education will be a tool to get people who have the means to replace the lines privately to do that. Have you developed an internal, do you have an idea of what the means to do that is, or is it more you put the word out and then whoever thinks they're willing and are able can do it?
Yeah, so the idea is that these advertisements would have some sort of a QR code, or also like, I guess, radio that would be like talking about the website, to link to the website that has the information on the steps that you can take to, see if you have a lead service line, and identify like what the steps you need to take to replace that line. Yeah.
Or
that makes sense.
Other questions? Dear Sarah?
Really lovely. Do you know how stable those child care centers are in their location, or do they blink in and out of existence? So I'm just curious about that. It wasn't directly part of your work, and that's fine. But
Yeah, I mean, not exactly the longevity of their operations, but definitely there is a definition for childcare facilities that the DEP uses, and so that would involve like not a family member, and then they're spending less than 24 hours a day there, and then some other stipulations. But yeah.
Time for one more. Back there. Yep.
Thank you very much, Margot, for really a fantastic presentation. I liked the intro a lot, and especially the success measurement as well. You guys were speaking about how you can measure the impact of that. What I would like to ask is, you mentioned that this program existed in 2022 already, and there they replaced, I think, 600 lines. How would you measure, when would you say is the implementation of the new program a success, and when is it a failure? Because you're mentioning how you would mention it, but did you guys have a discussion about when you would think it's a success, that the money was well spent?
Yeah, so we actually budgeted to have more replacements than 600, and we anticipate, like, factoring in holidays, we'll have about 650. And so we hope to reach that 600 number, but we've also been able to make sure that we can maybe surpass that. And I guess, yeah, we have our metrics for measuring success. And I think that those impact measures would also be pretty critical. And so in order to track, especially the drinking water and blood lead levels before and after replacement would be a key indicator.